Hello, my name is Rob August, and I will be your physical therapist today, and I will be assessing your wound.
Okay.
So I'm going to be asking you a couple of questions to get more information about your wound. Okay. So, how old are you, sir?
I'm 24 years old.
Okay. And what do you do as far as your daily activities?
I hunt and fish and camp also.
Okay. And what is your living situation?
A living situation, I live in a two-story house with a wife and two dogs.
Two dogs. Okay. So your wife would be your caregiver, and she's been taking care of you.
Yeah, for the past few days.
Okay. Cool.
Mhm.
What would you rate your general health at?
General health, overall good.
Good. Okay. Do you smoke?
I do not smoke.
Do you drink?
I don't drink.
Okay. And what are you taking as far as medications for your wound?
Just Advil for the pain because it's extremely painful.
Extremely painful. Okay. Extremely. All right. So, have you had any past medical conditions where, like, you had any wounds or burns?
Well, I burned my hand about 2 years ago, also in a camping accident. But other than that, no.
So, let's talk more about your wound. You say that this happened a couple of days ago, about 2 or 3 days ago.
Yes.
Okay.
Yeah, this past weekend.
This past weekend. All right. Perfect. When did you notice that you had a wound?
Right away. Right when it happened.
Right when it happened. So, can you describe exactly what happened?
So I was just around the fire, and all of a sudden, fire popped, and it just burned me, and some of the coals burned my ankle.
So the burn is primarily around your ankle region. Is there any other area that's been burned as well?
No.
Okay, good. All right. Um, so on a scale from 1 to 10, what would you rate your pain?
About a 9. It's pretty severe in the pain.
Okay. What have you been doing as far as treatment for the wound so far?
I've just been icing it, taking Advil, elevating it, but other than that, nothing. Um,
So I'm going to start off doing a general observation of the wound. And right away, what I notice is that there is a burn on his lateral malleolus. There's some edema, there's some swelling, and there's also some there's some blistering around the ankle region, kind of in the middle, and then around the edges is kind of the edema. I see some coloring. I see some pinkness forming. Maybe that's a scab. Um, and so that's gonna be like my general. And what I've noticed also is that the level of his wound, it's definitely the epidermis is involved. It's also a little bit of the dermis is involved as well. So I would immediately classify this as a second degree wound, second degree burn, excuse me, which is officially called a superficial partial thickness burn. And the next thing I'm going to go ahead and do is measure. I'm going to go ahead and measure the wound. I'm going to take the length, I'm going to take the width, and then we're going to go from there. So I'm going to have you go ahead and okay, good. So the length of the wound, 11 centimeters, and the width, like that, 10 centimeters. So 11 by 10. So next I'm going to be testing the range of motion. So, so sir, whenever you're ready, I want you to pull your your toes towards your body as much as possible. And he has about 15 degrees of dorsiflexion. And relax, relax, relax. Okay. So I want you to bring your toes away from your body as much as possible. Go, 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 go. And that is about 40 degrees of plantar flexion. So even though the 40 degrees is not normal, which is 50 degrees, he has 15 degrees of dorsiflexion. Normal range of motion is 20 degrees. But those are pretty decent as far as, especially with him having the wound, the burn there, and that I would anticipate that affecting his range of motion. So the next thing I'm going to go ahead and do is I'm going to test for his sensory, and I'm going to have two objects, a sharp and a dull. So I want you to close your eyes, and I want you to describe to me if it's going to be sharp or dull. I'm going to be freaking with both of these, okay? So one is dull, one is going to be sharp, okay? So go ahead and close your eyes, and you're going to tell me whether it's sharp or dull. What was that?
Sharp.
Okay. What was that?
Dull.
What was that?
Sharp.
What was that?
Dull.
And what was that?
Sharp.
And what was this?
Sharp.
And what was this?
Sharp.
And what was that?
Dull.
And what was that?
Dull.
And what was that?
Dull.
And what was that?
Sharp.
All right. So, by my assessment of his sensory seems to be pretty much intact. He was able to accurately describe the sensations that he was feeling in the area where he has experienced the burn. So the next thing I'm gonna go ahead and do is I'm gonna check his pulses. So the first pulse I'm gonna check is the dorsalis pedis. And that one would be +2 normal. I'm also gonna do the posterior tibialis. That one's also +2 normal. And I'm gonna do it on the opposite leg as well. So dorsalis pedis, normal, and posterior tibialis, normal as well. Okay. So motion. So now I'm gonna go ahead and do the strength. I'm gonna ask for you to kind of bring your toes away from your body, right? Like you're pointing it. All right, hold that position. I'm sorry. You're gonna bring your toes towards your body. Towards your body, you're gonna hold that, and don't let me break you. Okay? And relax. Good. So his dorsiflexion was pretty good. I didn't break him, so I would rate that a grade 5. And for plantar flexion, I'm gonna have you go ahead and stand up. And I'm gonna have you stand on your right leg and go ahead and lift your left leg. And I want you to kind of go on your toes, yeah, as much as possible. Go ahead. 2. Good. 3. All right, relax. All right, so really what I noticed was the first one was kind of clean, and then after that, the second and third and fourth one was kind of iffy. He was off balance, and I could see that the wound was affecting how he went on his toes. So for good measure, I want you to go ahead and stand on your left foot, and go ahead and go on those. All right, relax. So he did 3 good, and then the fourth one was kind of iffy on the left leg. So I'm gonna have you go ahead and sit down. Okay. So I would rate the first leg as a grade 3 because he did one really solid repetition, and then the rest was kind of his balance wasn't all the way there. But on the second leg, he was able to do a good 3 or 4 repetitions. So that would be a grade 4 on the left ankle. Okay, so the next thing I'm gonna go ahead and do is dip pose. So like I said, I'm gonna go ahead and describe his actual wound. So if you can go ahead and just turn that way, good, perfect. So like I said, this is a superficial partial thickness wound, which is also called second degree burn. Uh, he has some blistering around the center. And he has some edema all the way around here, uh, which is expected in a wound of this magnitude. He also has some peakness around the edges, which is a part of the normal process of the healing. Uh, he also has some dermal inflammation, which is which causes the edema that goes around the edges of his ankle. And overall, the skin color is kind of pink on the outside, and the blister is actually kind of this similar color to the color of his skin. Uh, and Yeah. So again, the depth of the wound is its epidermis is definitely damaged. It's also part of his dermis, his dermal layer as well. So that's the reason why I classified it as a second degree burn. And so that's going to be my description. And thank you for listening.